Basically, it was grassroots, started by a form of community leaders that based off of the community health needs assessment that's done every 2 years by Prisma and Bon Secours, had identified that there were over 70,000 individuals still that did not have access to care or insurance, so that they didn't have access to care.
Especially children, we give them immunizations. And this in turn helps keep the emergency room not as busy, and it gives them easy access. Also, we have translators here, and I think it makes the patients feel at ease to know they can come in and tell their problems in their native language.
I am the founding ED, so I was the first one that came in. We identified the location, brought in staff in partnership with Bon Secours. So you fast forward 7 years, and now we've expanded, so we provide a holistic approach to medicine, which is primary care, pediatrics, women's health, we have mental health, case management, and then we have the food is medicine program as well. So we really look at it holistically with all of the wraparound supportive services for our families.
I would say that the relationship we have with our patients is more like family. They come in, they know us by name, we know them by name, we know the children's name. So it's not just like, oh, you're here for your appointment, let me get you in, let me get you out. No, and we always try to help them, even with things that I haven't really seen in other offices, with like Uber transportation, if they're going through something and we know we can help in some type of way, kind of like baby items or clothing, things like that. We all come together and we help that patient out.
As far as patients coming in, we have partnerships with both health systems. Our community partners that are like, oh, we have a family that needs care, primary care, pediatric care. The school systems, a lot of them already know us, so they'll refer the families over to us. If they're uninsured, we have a sliding scale program based on family size and income, and that determines where they fall on our sliding scale program. So it can be anywhere from $25 a visit to $75 a visit. It just depends where they fall on the slide.
We're able to see the doctor without having to carry family medical insurance. We are able to come to the doctor because they base it off a sliding scale, and it's affordable. That's the only way that we're all able to see a doctor right now, because we just can't afford $600 a month in insurance.
Right now we're a little over 2,300 patients a year. So we do 2,300 patients a year for about 7,000 visits. When it comes to the mental health component, we probably have a little over 500 unduplicated patients, and that can be close to 2,000 visits because the average is about 6 to 10 visits per person.
Well, the mission here is to deal with the person in a holistic point of view, to see their physical needs, spiritual needs, their mental needs, and of course food insecurity as well, and find some way to help them find a balance within their family unit or within the community with other nonprofit agencies, with the care that they're given here, to bring consistency and peace to a family.
Starting with the DEI cuts, we lost a couple of grants due to that. That was about $140,000. And then we had some federal dollars that are basically frozen. And we don't know, we're not anticipating receiving those for 25. We're hoping, and we remain very optimistic that we'll get them for 26. But we just have to wait and see. So that's created this unneeded stress. I mean, it's already difficult to, to be able to write the grants, secure the grants, and then to be able to keep, operations going. But when you lose that amount of money, it's just a big hit. And, at the end of the day, we're here to be able to provide services for our families. Healthcare, mental health, all of it. So when we lose that type of funding, then we lose capacity. We have to let people go, or we have to cut programming, and these are programs that, they wouldn't go anywhere else for. A big part of it is that they trust us. So when you have your families coming in because they trust you, it's very difficult for them to start someplace else new.
Think about the children, because there is a lot of undocumented children as well, more than we even could imagine here in Greenville. Not even only in Greenville, Peasley, Pickens, Spartanburg, that don't have medical care at all. Put yourself in those parents' shoes. You had to bring your child from Mexico, Guatemala, Honduras, El Salvador, escaping crime, gang relations, or just wanting a better future for them. You had to bring your children here. in order for them to receive the proper medical care, proper schooling, to make sure that they grow to have a better future than you as a parent. And to take away the one place where they feel safe, they feel heard, they feel seen, they feel welcome, it's like ripping a Band-Aid off.
We're a trusted resource, not only with our families, but with our community partners, my team, local leaders. You know, they trust us, and that's one thing, is that, you know, the resources and that you feed into us is not going to be a waste. It's going to be used for the betterment of the community of Greenville. At the end of the day, that's who it's for. And we want a healthy Greenville, and with a healthy Greenville, we need to have healthy families.
You're helping people that can't help themselves at times. Certainly provide a good service to the community that otherwise they'll be just thrown into the mix of being seen at the emergency room and then going home and then not having any follow-up.
Help us. Help us help those that live within our community. Help us help the families and the children that have needs that sometimes may have gone unmet for a long, long time. And knowing that the little change that we can make at the beginning can become a big change later on in the future.
We have a team that is so dedicated, very compassionate, and they love our patients. For the month of April, our providers volunteered all their time to make sure that we keep our doors open for our patients. I don't know any other place that would do that. But they wanted to make sure, like, Norma, if this is what we can do to help, this is what we're gonna do to help. And I was just like, I mean, that's a blessing. So what gives me hope is that I have a team that's amazing, that's here to do the work they're calling, to be able to continue to serve our community. And that gives me hope, because I know if I have a team that does that, Greenville's a very giving community. I have hope in that they're gonna help keep us alive.